Okay, thank you, Miloslav. Thank you all to stay here to listen to our presentations. I'm going to present an evidence-based practice, well, an evidence-based learning program, educational program. The background that supports all this is, well, it's a little bit big. A lot of things you already know, so I will pass them very quickly. Probably is more interesting the discussion why we decided to build this program, to validate this program, and to test this program. Of course, everybody agrees that evidence-based is necessary in the context in care, and we need to develop all this work. That's why we are here working all together today. Everybody understands that it promotes high-value healthcare and patient experience and so on. And evidence-based practice is important, the adoption, implementation, and sustainment of evidence-based healthcare in healthcare and organizations. Also important to policymakers, I'm sure. Yeah, is recommended by Agency for Healthcare and Quality and other organizations, the National Council of Nursing and International Council of Nursing, and this, well, simplify decision making and reduce uncertainty, risk, and different things that you know. So, and other statements that say that all healthcare professionals need to understand the principles of evidence-based, the recognized evidence-based in action in healthcare, and so on and so on. So this is something that everybody knows. Question is, we know that is not the standard care in different situations. There is a lot of gaps that we need to solve, and the best way to do this is to start to educate health professionals like nurses, well, to work on evidence-based. Because if we don't start to prepare them in the undergraduate programs, will be much more difficult to develop this area. So these competencies regarding IBP should be used in all professionals, educational programs. Should be on undergraduate nursing curriculum. Other healthcare professionals will improve different outcomes and promote evidence-based practice and so on. So based on this, and we had some experience on this area, but we realized that it's not enough. We train them in the area, the research area, mainly in primary research area, but it's not enough. So when we look to the students, when they need to perform a work, develop a work, when they go to clinical practice, where do they find information? In several places, mainly in Google, and the idea is how should we prepare them to be critical, not use all the information that arrives to them. And well, we need an educational program intervention, and design, validate to try to improve this, the education. And then we try to explore the opinion of the students who underwent to the intervention. We followed this great checklist. It's guidelines to develop and to validate this type of programs. This is 2 phases. The first phase, development of the intervention. So 2 scientists, researchers develop an EBP educational intervention. And then the second phase, the draft was sent for opinion of 8 experts of different backgrounds, nursing, psychology, education, which I appreciate. And the opinion was evaluated, and suggestions were incorporated in the intervention. And then the first phase, we applied it in the Portuguese context between February and June 2018. The intervention was applied to the Portuguese 4th year undergraduate nursing. We have a program of 4 years, so they were in their last year of the program. And there was requested the feedback of the participants through an online questionnaire. So the results of the second phase, the 8 experts analyzed this program proposal. In overall, they considered the program is well designed, but recommended some adjustments, clarify objectives, the target population, include the final assessment of the students' opinion regarding the program, what we did. And the big issue is, and this is, I think this is the main discussion we should have. How can undergraduate students be prepared to understand if the information they get from whatever source, databases or whatever, is reliable? Should they be prepared to start to develop this appraisal or not, or no? We think in this type of program it's a little bit impossible to, for them to develop those skills. We agree that they should be included in groups where there are different types of skills of undergraduate students, master students, PhD students supervised by other experts and specialists in the area, and they could start to understand the importance of the information, the quality of the information, and this is something they should understand, and they should understand that they can't accept all the information that comes without knowing that somebody already assessed this information and provided reliable information. Of course, this program has these limitations because it's not possible to develop those skills on that students. So what was the theory of, it's based on the JBI model of evidence-based healthcare. The objectives are to know the ABP models, different ABP models, well, mainly the JBI model that where we based our work. To develop a focused review question. This is not a review question to synthesize information. This is a clinical question, and this is the main area where we invested a lot to help them to develop a well-designed clinical question, because they are not prepared to synthesize information. They are prepared to search for the information based on a well-developed question, and this is the very important discussion, and I think it's where they have more difficulties to develop this type of question. So they need to identify the most appropriate study designed to answer the question, to show knowledge regarding database search, to analyze the search results, to answer to the review, and to know, software to develop systematic reviews, just to know. The skills are not to them to learn how to work with them, but to understand that somebody already synthesized that information and is the way it works. And identified important aspects that determines the relevance and validity of the particular study. So we designed the program with 6 sections, and it ran during 17 weeks. Sessions 1 to 3, it's 12 hours, 4 hours by session, and during the first 7 weeks. And then the sessions 4 to 6 is 6 hours, 2 hours by session during the last 10 weeks. We used, materials, PowerPoints, papers of reference, worksheets, and other materials. Our population were the 4-year nursing undergraduate students, and the students is face-to-face with instructors for entire session period. It is expected that most students spend about 10 hours of own work after to be with the instructors, and then in next session they will bring other questions and will be guided to try to answer to them. So the final program is the, well, session 1, 2, 3. So the first one is more for 1, 2, 3. It's more theoretical, more expositive methods, and that's about introduction to evidence-based, to types of systematic reviews, review question development. Then the second is searching for studies, study selection process, data extraction and synthesis. So we developed this face-to-face with 20 to 30 students in the class. And then the next sections 4, 5, and 6 is to define a review question of interest to students. They work in groups of 3. And the important context in their clinical practice. Definition of the search strategy to answer the review question, and classification and guidance of the study selection process, the data extraction and synthesis to try to answer the question they already posed in the beginning. So the key here is an active method of mentoring, face-to-face in groups of 2, 3 students, and they are the mentoring is done only with the group, directly to the group. So the third phase of this development is 16 undergraduate nursing students who underwent the intervention who were answered to an online opinion questionnaire, and they had positive feedback, but they recommended the inclusion of more hours of mentorship. They like mentorship, and on that hours of mentorship, they learn a lot because they have some problems. The supervisors just explain, then they go to work like the 10 hours of study, and then they return again, and they try to answer to the questions they have. So this, in conclusion, the positive feedback is, there is a positive feedback from experts and students for this program. Seems to be appropriate educational intervention. And we are now, we are now assessing the results. What we did is to do a randomized trial where we randomized them by clusters. It's 90 students in each group. The control group is the usual education that is undergoing in the school. And we added this new intervention to the other group. And we are now analyzing the outcomes. And we think they are very positive. We analyze in different ways. For example, we used Fresno. It's a type of tool to assess knowledge. And because they answer to this questionnaire before the intervention, and they answer again after the intervention, and this tool asks them to put questions, to present strategy, and so on and so on and so on. So it's really knowledge. It's what they really know about it. It's not about attitudes, just attitudes or thoughts or whatever. It's what they know, what they are able to develop. And we are now assessing the results and try then to implement this type of programs in the curricula. So we acknowledge to our research unit, to the Portuguese Foundation for Science and Technology, and some of the experts that helped us. My friend Miroslav, Judith, they are here. Marianne Ramis, Rui Pereira, another colleague, Lucimar Ferraz from Brazil, Cristina Vieira is from the psychology faculty, and those other colleagues are from our center. And this is our work, so it's some references. So if you want to put questions, I'm very happy to answer them. Thank you very much.
Okay, okay, perfect. Thank you very much, Joao, for a very nice presentation. I already see we have a first question here from audience.
Thank you, Joao. That was really interesting, and it's great to see work being done with undergraduate nursing students, because we often tend to focus on the postgraduate. Did you have any issues in terms of ethics? Because obviously you randomised the groups to the different type of education. I just wondered how...
We submitted the research the project to the research committee, the ethics committee we have there, and they answer, and it's well, it's approved by them, and the students signed the consent and informed consent, and we had the approval of the school, of the institution. So we have well, follow all the rules. Sure.
And have you got plans to roll that forward for all students now? Are you hoping
for next students?
Yeah.
We have, after analyzing the program, actually this is one of the parts of the PhD program of Daniela that you know, and after to have all those results and to report and so on and so on, what we are going to propose is to the board, to the scientific board, the possibility to include this type of working, because the difference is this is a structured, organized program. It's not just in some parts of the program just to give them information about this. Actually, this was this began in a postgraduate in the postgraduation in elderly care, where we started with this, and then I realized that this type of intervention, that is be with the students, make them asking questions, go home, improve them, come again, then try to improve, then go to the search strategy, and then we help them to in groups to do the search, and we say, wow, this works, because other situations, other experience we had, we put the students on the classroom, the undergraduate students, and even the graduate students on the classroom. We teach them how to search all this situation and questions and so on, and then we expected, well, in next year or next semester, when they go to clinical practice, they will search information like this. Never happened. Never happened. And like this, because we do it with them, they actually understand, because something is to know how the things is what is the best way to do it. Other thing is to do with them. And there is another implication of this, because the professors, the students' professors in the school, are very happy to know this program and to try to implement them in the future. So they understood that there is something new and structured and important. This is one of the outcomes also. So like this, we probably are going to influence, I don't know if it is change, but influence the way this organization is on the school.
Very good, thank you. Do we have another? Yes, we have here in front. Andrea? Maybe the battery, so you can use this one.
Thank you, Joao. It was really excellent. I'm a little bit envious because we have just 3 years nursing study, and we really want to have 4 years study for undergraduates, but then we won't be able to really survive on the market of education, you know, because we have most of the bachelor degrees lasting for 2 years.
Yeah.
But my question was, if I catched it right, if I understood it right, you have it in the 8th semester of study.
In the 8th semester.
It's just for a pilot study.
Yes, or just for a pilot. Now we are going to decide if there are some parts of the program we should include previously.
Yeah,
because at the end of the semester it's maybe
not too
a
late,
bit,
because they can
yeah,
use it in the clinical practice.
it is, but it's will be better if we started. This is a discussion we are taking there, and the question is, even we had two main outcomes. The one is from Fresno, that is really knowledge. They got to write like a proof, okay? And we understand even the students, we are analyzing data, even the students that were under this program, they are better than the others, putting questions more accurate, more and search strategy and so on and so on. But they have difficulties, some, okay? And we have other outcomes, but there is one that at the end of the graduation, they got to do like a thesis, okay, in groups of 3. And this thesis is related to clinical practice. And we assessed a sample of different theses, the ones that underwent to the program and the others didn't. Of course, I'm not presenting all those results. And what we understand is, well, actually we asked two colleagues to assess the quality of the thesis, independent assessors, and they don't know who is the thesis, if it is from the control of the other group. We just supervise them, say nothing. The theses were there in a table, just you have this criteria, this, and just assess it. We prepare them first. And we realized that there is the difference.
Okay, thank you very much. Our students have to, at the bachelor level, I think, and it's the same in most of your countries, they have to prepare individual thesis, bachelor and also master. So we know it. I'm only afraid if we will implement it, and we have had implemented in some studies already in our country, but if we will implement it too early, then we will destroy some nursing teachers, you know. Because our students then will be able to think more critically than their teachers sometimes. It's true. Thank you very much.
Thank you.